Welcome along to Pathways in Paediatrics. This is episode 2. We're really pleased to be back. And yes, we are AI-powered, here to help guide you through some really compelling developments happening right now in pediatric care. Today, we're going to dive deep into a theme from the upcoming EAPS 2025 Congress that's, well, it's both crucial and absolutely fascinating: immunology, genetics, and rare diseases.
It really is a vital area. And the European Academy of Pediatric Societies Congress, that's happening October 18th to 20th, both in Lisbon and online.
Yeah.
It's just consistently the place to be.
It really gathers the brightest minds, doesn't it?
It does. Since 2006, it's been, the key congress for pediatricians, researchers, healthcare professionals. It's where you find the latest global research, new devices, therapies, all the big developments in our field.
Absolutely. So our mission today is really to give you a sneak peek, a bit of a preview into the kind of groundbreaking discussions and presentations that are set to shape how we understand and treat rare conditions in children going forward.
And what's really striking when you start to unpack this theme is just how interconnected everything is. Immunology, genetics, rare diseases, they're tightly linked.
How so?
Well, many rare diseases, as we'll explore, they actually stem from genetic origins, genetic issues that directly impact the immune system. And almost always, the key thing, the absolute linchpin, is early and accurate diagnosis.
Oh.
That's what really leads to better outcomes.
Okay, that makes sense. So that interconnection is the thread we'll be following. Let's maybe start with inborn errors of immunity, IEIs. Managing those in an urgent setting like the emergency room sounds like a major challenge.
Oh, it definitely is. And it's one that needs a really systematic, rapid response. We looked at the work of Per Solia-Pallesen, Jacques-Gabriel Rivière, and Andrea Martinalda. They'll be presenting on how to handle the immunodeficiencies in the emergency room.
Okay, what are the key takeaways there?
Their work really highlights something important. While each IEI is rare on its own, collectively they affect a significant number of kids. We're talking maybe 1 in 1,200 to 1 in 2,000 individuals.
Wow, that's actually quite a lot when you put it like that.
It is, and it means they need very specific emergency management. General protocols often aren't enough. They stress the absolute need for established local protocols. These act as structured recommendations.
Right, sort of a clear action plan.
Exactly. Think about it. A child comes in, IEI is suspected. You need immediate steps, prioritizing triage to at least level 3, early isolation if there's a high infection risk, getting a really comprehensive history, the anamnesis, and a thorough physical exam.
So it's about having that system ready to go when, every second counts.
Precisely. It can make all the difference in an emergency.
Okay, so you have that initial suspicion in the ER. What about the next step, the diagnostic journey? Getting that confirmed diagnosis can take time.
It absolutely can, and shortening that diagnostic odyssey, as it's often called, is a huge focus. Claire Francarava is going to provide some really practical information on this. Her talk is Workup in Infants and Children with Suspected Immune Deficiency.
Sounds essential. What kind of practical info?
It aims to clarify exactly which lab tests to order, and crucially, when. Interpreting the basics like the complete blood count, looking for telltale signs, but also immunoglobulin levels, lymphocyte subsets for a detailed picture of immune cells, and even understanding functional tests. How well are these cells actually working?
So it helps clinicians navigate that testing pathway more efficiently.
That's the goal, yes. To cut down that delay in diagnosis for primary immunodeficiencies and get kids onto the right treatment path much faster.
That clarity is just so vital. Okay, let's zoom in a bit now. You mentioned the immune system's complexity. What about the complement system? It's a part I feel isn't always front of mind.
You're right, it's often overlooked, but incredibly important. And Michael Kirschfink is giving a key update. It's based on the European Society for Immunodeficiencies and European Reference Network on rare primary immunodeficiency, autoinflammatory, and autoimmune diseases complement guideline. Deficiencies, diagnosis, and management. Quite a mouthful.
Ha, yes. So the complement system, remind us.
It's a critical part of our innate immunity. Think of it as a cascade of proteins helping to clear out pathogens and damaged cells. Now, defects here are rare individually, but they make up about 5% of all primary immunodeficiencies.
And what kind of problems do these defects cause?
A really broad spectrum, actually. It can range from severe infections to autoimmune and inflammatory disorders, and they often show up in childhood.
Wow, okay. Can you give some examples? That seems like a huge range.
Sure. So defects early in the classical pathway, one of the main activation routes, they significantly raise the risk of autoimmune diseases like lupus. Issues later in the pathway, or with a protein called properdin, they make individuals much more susceptible to dangerous meningococcal infections.
Meningococcal disease, right. Serious stuff.
Very. And then there's C1 inhibitor deficiency that leads to hereditary angioedema, or HAE. That's the condition with sudden, severe swelling. Complement dysregulation is also linked to kidney disorders like atypical HUS or C3 glomerulopathy, and even, perhaps surprisingly, age-related macular degeneration, AMD.
AMD. That's fascinating, linking it back to this immune pathway.
It is. Modern analysis lets us understand these defects really deeply now. But therapies, well, they're advancing but still limited for many of these, though HAE is a bit of an exception with targeted treatments. Management often involves a lot of education, family screening, and preventative measures like vaccines and antibiotics.
It's incredible how one system glitch can ripple out like that.
Yeah.
Now, building on this idea of underlying issues, sometimes that genetic susceptibility isn't obvious, is it? Even if there aren't broad immune problems.
That's a really sharp point, and it leads us perfectly into Roger Colobran-Oriol's presentation. When to suspect genetic susceptibility to infection. He's exploring that remarkable variability we see. Why does one child get a sniffle from a bug while another ends up severely ill?
Right, the individual response.
Exactly. And he argues that sometimes this variability points to an underlying monogenic inborn error of immunity, a single gene issue.
Even without the classic widespread immune deficiency signs.
Precisely. These IEIs often give a very narrow susceptibility, maybe just to one type of pathogen, like certain viruses or fungi, and they might not have obvious abnormalities on standard immune tests. Plus, there's incomplete penetrance. Sometimes not everyone with a gene variant gets sick.
Can you give an example of that kind of specific link?
Yeah, he'll discuss things like herpes simplex encephalitis being linked to defects in TLR3 pathways. Those are sensors for viral material. Or Mendelian susceptibility to mycobacterial disease, which involves problems in the IFN gamma circuit, crucial for fighting those kinds of bacteria. And chronic mucocutaneous candidiasis, often linked to impaired IL-17 immunity, which is key against fungal infections.
So finding these specific genetic links is becoming more possible.
Yes. Thanks to next-generation sequencing targeted panels, whole exome, whole genome sequencing, recognizing these monogenic causes is vital. It helps with diagnosis, prognosis, and importantly, guiding personalized therapies and prevention, tailoring treatment to the specific genetic defect.
That really feels like the future, doesn't it? Understanding those very specific individual vulnerabilities.
Okay, shifting gears slightly, but staying with critical conditions. Hemophagocytic lymphohistiocytosis, HLH. That's another one where early suspicion sounds absolutely crucial.
Critical is the word. It's often a medical emergency. Antonio Marzala will be covering this from the immunology perspective. When to suspect, how to diagnose. HLH is fundamentally a life-threatening hyperinflammatory syndrome. The immune system goes into overdrive because certain cells, cytotoxic lymphocytes and NK cells, fail to regulate themselves properly.
And that leads to multi-organ problems.
Yes, uncontrolled immune activation, causing widespread damage, often multi-organ dysfunction. Marzala stresses the absolute #1 step: maintain a low threshold for suspicion in any patient with unexplained inflammation, whether it's systemic or affecting just one organ system.
That sounds tricky, though, because inflammation is so common. How do you maintain a low threshold without, over-investigating everyone? Especially when HLH can mimic other things. That is the challenge. HLH often looks like sepsis or systemic inflammatory response syndrome, SIRT-RS. That's why clinical suspicion is key, especially if a patient deteriorates rapidly without a clear cause. He'll detail the classic signs: persistent high fever, enlarged liver and spleen, unexplained low blood counts, or cytopenias.
And are there specific lab markers?
Yes, some really important clues. Markedly high serum ferritin is a big one, often extremely high. Also hypertriglyceridemia, high triglycerides, and elevated soluble IL-2 receptor levels, which indicate massive immune activation. His talk will also cover the updated 2024 diagnostic criteria, which helped standardize things. And crucially, the need to dig for the underlying trigger. Is it an infection, autoimmune disease, malignancy, or an underlying genetic defect in those cytotoxicity pathways?
So it's about recognizing the pattern early, using the criteria, and then finding the why.
Exactly. Timely diagnosis hinges on that early recognition and then targeted investigation to find and treat the root cause.
We've covered so much ground on the immune system and genetic links already, but the theme genetics and rare diseases also pushes into areas where science intersects with, well, society, ethics.
It certainly does. And this brings us to a really interesting and evolving area. Nicholas Kelfa is addressing this with New Paradigm and Challenges in the Management of DSD, the example of the French National Reference Network. DSD refers to disorders, or differences of sex development. And their management is undergoing pretty profound changes, especially in Western societies.
Changes towards what exactly? It sounds like a move towards more patient involvement.
Precisely. There's a definite shift away from early childhood surgical interventions that were previously more common. The focus now is much more on allowing for individual autonomy and ensuring the person themselves can participate in decisions about their body later in life.
And how is that being implemented?
PELFA uses the new French bioethics law as an example. It specifically regulates interventions related to variations in genital development. It mandates national multidisciplinary meetings where the individual's consent is central to any decision about surgery.
That sounds very progressive. Are there challenges with this new approach?
There are. While it's progressive, it raises new questions. Things like, how do you balance this with parental choice, especially for younger children? What is the age of autonomy for these decisions? And, frankly, we lack long-term comparative scientific data on early versus late interventions to guide these choices definitively. It really highlights how DSD care sits right at this complex intersection of society, politics, religion, philosophy. It's not just about the medicine.
Wow, what an incredible range of topics under just one theme at EAPS 2025. Truly amazing. We've gone from the ER management of immunodeficiencies, the details of the complement system, those subtle genetic risks for infection, the urgency of HLH, right through to the complex ethical landscape of DSD. The sheer breadth of knowledge being shared is it's genuinely inspiring.
It absolutely is. It really underscores how dynamic and multidisciplinary pediatrics is today. This Congress really promises to be a powerful forum for advancing how we understand these conditions and ultimately how we improve outcomes for these children.
Well, we really hope this overview, this sort of guided tour through some of the upcoming talks, has sparked your interest and given you that shortcut to being well-informed. And perhaps it leaves us all thinking, as our ability to see these intricate genetic variations grows, what new frontiers will open up and what new responsibilities come with that knowledge.
It's a lot to think about. And we absolutely encourage you, if you can, to join the discussion at EAPS 2025. Whether you can be there in person in Lisbon or join online, that's October 18th to 20th. It's an opportunity you really won't want to miss.
We look forward to exploring more key topics in pediatrics with you in future episodes of Pathways in Pediatrics. Until next time, stay curious, and thanks so much for joining us.